My name is Reecha Sofat. I'm a consultant clinical pharmacologist. That means I work clinically in a hospital and do research, and my research is mainly focused on genetics. So one way genetics can be relevant to everyone is medicines. This is because the way the body handles medicines can be affected by our genes. This area of study is known as pharmacogenomics. A number of doctors already use genetics in their practice. However, this is often limited to rare disease. Cancer doctors also use genetics, as a mutation in the cancer could be the target of a treatment, which can then greatly improve outcomes. However, what is not yet tested is how genetics can be useful for all diseases or for routine healthcare visits, and this is what we're interested in. These advances are only possible because of the programme of 100,000 genomes led by Genomics England, which has meant that there are now genome sequences within the routine healthcare record. We're now working to agree how we make this information available on electronic health systems, both in hospitals and GP surgeries. The ultimate aim is for this to be of benefit to patients so that they can be prescribed safer and effective medicines. So if you went in as a patient to your doctor or whoever prescribes that medicine and an alert comes up to indicate that you have a genetic mutation that changes the way that you handle that medicine, that prescription could then be altered by the doctor or the prescriber to either a medicine that is more effective for you or to change the dose of that medicine so that you receive the benefit that is intended. For the most part, it is about sharing the information with clinical teams, but we feel it is also important that as a patient or member of public, you know about your genetic information and how that affects the medications you might receive when you have treatment. This also means as a patient you can always sense check the information. It is important to mention that all genetic information is safeguarded and only shared with relevant clinicians who are caring for you and prescribing your medication. This is a real step change. It's made genetics available within the routine healthcare record and touches upon the commonality to everyone or every patient, which is the prescription of medicines. The ultimate aim is to improve prescribing for patients for better healthcare outcomes.